Over the past 5 years, the world has faced a silent crisis: depression, anxiety, anguish, and even physical pain. These struggles have touched millions of lives across every nation, every community, and every family. In 2019, more than 280 million people worldwide were living with depression. That's about 5% of all adults. Women were almost twice as likely as men to experience it, and young people were already showing signs of rising distress. Then came the pandemic. In the very first year of COVID-19, global cases of anxiety and depression increased by 25%. Isolation, grief, fear of infection, job losses, these pressures combined to create a worldwide mental health emergency. By 2021 and 2022, surveys recorded record highs: stress, worry, sadness, anger, physical pain. Gallup called this period the peak of global anguish. In the United States, the story was just as stark. 1 in 5 adults reported chronic pain in 2021. By 2023, it had risen to nearly 1 in 4, and for almost 9%, the pain was so severe it disrupted daily life. The burden wasn't equal. Some groups suffered far more than others. Young women, especially between 16 and 24 years old. In England, more than a third reported a mental health condition by 2024. LGBTQ+ youth, and especially transgender teens, faced rates of depression up to 4 times higher than their peers. In the U.S., American Indian and Alaska Native communities carried some of the heaviest mental health burdens. People living in poverty, with less education, or in rural areas also showed higher levels of depression and anxiety. And across nearly every survey, women consistently reported more distress, more anxiety, and more pain than men. The causes are complex, but a few stand out. The pandemic disrupted lives everywhere. Economic hardship and cost of living crises created constant financial pressure. Loneliness and social disconnection reached epidemic levels, and in some regions, armed conflict and displacement only added to the suffering. So what can actually help? Science gives us some clear answers. Therapy works. Cognitive behavioral therapy, CBT, is one of the most effective treatments for both depression and anxiety. Interpersonal therapy and behavioral activation also help people rebuild structure and connection. Medication helps too. For moderate to severe cases, antidepressants such as SSRIs and SNRIs remain reliable options, often most effective when combined with therapy. Lifestyle matters. Exercise has now been proven to act like an antidepressant. Jogging, walking, yoga, strength training all reduce depressive symptoms. And the more consistent the activity, the greater the benefit. Sleep is powerful. Treatments for insomnia, like CBTI, improve rest and reduce both depression and anxiety. Mindfulness and social connection also make a difference. Mindfulness-based programs help prevent relapse in people with recurring depression. Chronic pain requires a joined-up approach: psychological therapy, physical activity, multidisciplinary care. Treating pain and depression together is far more effective than treating them in isolation. The last 5 years have tested us all, but they've also revealed an essential truth. Mental health is not optional. It is as vital as food, water, and shelter. So if you are struggling, remember this: you are not alone. Help is real, and hope is within reach.